That too.
Lower the bed. I had the side rail up, but I need to lower the bed all the way to the floor. All right. So now I've wiped the leg down, and I'm gonna blot dry again. We don't rub because that can cause people to get chapped, and it's damaging to their skin. We just blot dry. And then I can come down here to the foot. Can we cut toenails?
No.
No.
Right. ACC says no. Now, some places I've worked, nurses could. I'm not sure what the current thing is here at the hospitals, because I only worked in the cath lab when I came to work here, so I never had to do nail care. But I have done nail care, and you can do it. You just have to be really careful if your patient is what?
No.
Diabetic. And also, if they have cardiovascular disease, in the extremities, if they have bad circulation to their legs, okay? You always want to do that, not cut them. But what I can do is I can file them off, and I can use an orange stick to clean under them, because I want to make sure they're clean, and I want to really look at the feet, look in between the toes and behind the toes, because that's usually where they get a little sore, and then as it breaks down, they end up having to lose their foot or their leg or worse, okay? When they get infections in an extremity and they have poor circulation, they don't heal very well. And diabetics heal worse, even more so. They're even worse about not being able to heal. The best way to prevent them is to prevent it from occurring or to catch it early, so you can take care of it. Okay, but what can you do if the family asks you?
Teach them how.
You can teach them how, and what's the right way to tell someone to trim their nails?
File.
Straight across. And we don't talk about it, but the same thing goes for diabetics in their arms. Their fingers don't have good circulation,
Right.
and so they can get an infection real easy, or just a little cut can make them end up losing their limb. So, all right. So I blotted that dry. Now, I need to put their TEDs back on. I'm going to need to take my glove off for that. But also, I need to teach my patient what these are for, right? So I talked about it to you, but here's how I would tell him. Do you know what these stockings are for? They're to help keep the fluid from building up in your legs so that you don't get a clot or something we call a DVT, and that you don't get a stroke. So these are something that you need to wear all the time.
May cause diarrhea.
Do what? May cause diarrhea. That's a new one on me, but all right. And so the way that you put them on, there's a special way you have to put them on. I reach down in the stocking. You see how tight they are? Well, and I have large hands, so. But I reach down until I get to the heel cup, and you can kind of see it. Can you see that white square there?
Yes.
Okay,
Really
I
tight.
grab a hold of that and hold on to it, and I turn it inside out. All right. Now, here's the bottom of the foot on this side. This is the top of the foot. I know where it is. Can I borrow your hand? Because these are too hard to get on the
They're
mannequin.
really, really tight.
So what I'll do, if you just put your hand up, I'm going to slide it on like that, and then I'll try not to pinch you. I'm going to start working the stockings up.
God, the fits like that straight jacket you wear.
Did I hurt you?
No, you're good.
You're just giving me a hard time. You stinker, you. You see how I'm doing this, though? I'm just getting a little bit of it and working it up.
Yeah, I think it is tight. Ooh.
It is
They're
tight, isn't it?
very
I don't
tight.
want these wrinkles on here, because everywhere there's a wrinkle, that's going to make it even tighter. But I don't want to stretch it too much, and I'm going to quit pulling on it.
Yeah, it's like, it's probably not going to work.
Yeah.
They're really,
I don't want
really
to
tight.
ruin your watch. I don't want to stretch it too much like this, because then the stretchy around is in the wrong place. Does that make sense to everybody?
Yes.
Okay. Then once I get it on, I'm going to pull on it so I make sure this end is not putting pressure on its toes. And the reason they put this hole in there is so I can open it up and peel it back over their toes, and I can do my neurovascular check to make sure that they're okay. So before I would put it back on, That's what I would do. Does anybody remember what's in that? A CMS or neurovascular check?
The polar.
Color, motor, sensitivity.
Yeah.
You got it. Okay. So you're gonna learn in a couple of weeks how to do pulses, but I would do check for pulses to see what they were like on the dorsalis pedis on the top of the foot and then behind the ankle. You don't count that pulse, you're just feeling it to see what the character is, if it's a strong pulse or a weak pulse, or if it's present.
So
Then
I
I feel.
have
Yes,
a
ma'am?
quick question. When you said we're checking for the pulse and everything and sensitivity, say the patient has a cold spot, which would typically indicate lack of blood flow there.
Mm-hmm.
Would you still apply it or hold off? And then, I mean, of course,
On the
ask them.
TEDs,
Yes, on the hose.
I think it would probably be okay to put it on there because you're still supporting the circulation, but you want to report that to the doctor.
Right, okay. I'm just
Okay.
curious if it's a.
Yes, ma'am.
So
Got
are
it.
we gonna practice putting it on the mannequin or just knowing
won't-
how to roll it and put
Right.
it up? Okay,
You need to know how to prepare it, how to roll it.
okay.
If you want to try it out on your partner, you can.
tell you.
But no, we don't have all the different sizes. And the mannequins, I mean, you know how hard it is to put socks on kids. It's even worse on a mannequin.
It's not. My body's their foot
Okay,
up at the chin and put it on.
So anyway, I'm doing my check before I put it on. I've checked my
Cutest thing
pulse.
ever.
I feel the skin to see if it's warm or cool. I look for the color to make sure it's the right color for them. One way you can say normal for ethnicity. That's an easy way to chart it, and everybody knows what you're talking about.
Right.
Then I'm gonna ask them to wiggle their toes. I might ask them to move their feet. I might even say push against my hand so I can see how strong their
Right.
foot muscle is.
Flexion.
Then I'm gonna ask him if he has any numbness or tingling, and I'm gonna inspect the entire foot and the leg that's gonna be covered up, and I'm looking for, usually cold spots, those are gonna be dusky and they've already lost circulation.
Yeah.
But what you're gonna see first is a white spot or a red spot.
Right.
If you have a spot that's red and stays red, that means the circulation's already compromised.
Right.
When it starts turning pale and white, then that means the capillaries have already broken down, they don't have
Completely.
circulation to it.
Okay.
And if you see a spot like that, are you gonna want to rub on it or anything
No.
like that?
No.
Okay, and for that one, I wouldn't put the TED back on until I
Okay.
check for the doctor.
Okay. That's what I
Okay?
was.
All
Okay.
right. So I've done color, I've done motor. There's one other thing I can do to check for capillary circulation, the capillary refill. Yes.
That on top of the foot,
Does everybody know how to do that?
Yes.
Okay.
3 seconds.
You can kind of see, you can do it anywhere. You don't have to do it on a nail bed. 1,000, 2, 1,000,
And
3,
three.
1,000. I
Make sure
pick
the
back up
color
within 3 seconds.
picks
That's
back
normal
up.
capillary refill. It can be faster, but if it's slower, that's something you want to let someone know. Because that means the capillaries are already having problems. Okay. So I'll put my TEDs back on. Since he can't get out of bed, I'll put my SCDs, sequential compression devices, back on.
Did they used to call those PLCs?
And they show you what you have to do to put them on. It says
Facial
put this
legs.
behind the calf.
Right.
So you put it on, and when you're doing it with your partner, just lay the stocking on top, put this under, and then you just kind of, you don't want to make it tight.
Right, because it's gonna
You just
inflate.
loosely put it on there.
Right.
If
Are
you
we
put it
also
on,
educating the patient?
I'm sorry.
Are we also educating the patient
Yes.
on what that's?
And this does the same thing. These are both things to help keep you from getting a DVT and causing you further problems and keeping you in the hospital longer. And usually if you throw that last little phrase in at the end, they're willing to go along with anything. If it'll get them out sick. Can they ambulate with the SCD on?
No.
No.
No. This little tube that comes off of it
It clicks in,
is
clicks
a trip
out.
hazard, and you'll see people do this.
Yep.
That's not safe.
It's
Okay?
not.
All right.
Right.
So I've done that. Now, I've done the leg. I've taught him about his stockings and his SCDs. The one thing I didn't mention, the stockings are sized just like shoes.
Right.
And if they're knee high, we measure from about an inch below their knee down to their ankle, the heel, and then we measure around the fattest part of their calf, and that shows us on the chart what size they wear. They can also wear thigh highs that come all the way up to the thigh. And those, by the way, are really good to wear if you can handle it. So you won't be so tired by the end of the day because all that blood's coming back up. Your legs aren't having to do all the work. And that was something they taught me when I first got out of school. But they're too hot for me now, so I don't do it. But anyway, you measure from the top part of the thigh down to the heel and then around the thigh to know what size to put on. They have some that are called waist high. They don't really go all the way up to their waist, but they have a belt that fits around the waist and then a little strap, kind of like stockings used to be with the garter belt. And those are the easiest to wear. Okay. The thing about TEDs is they ride down. No matter what you do, they're going to work down just like socks do. So every time you come in the room, you want to double check and make sure that they're still in the right place. And if they've kind of gotten wrinkles in them, you don't want to just pull them up and you take them off and start again. Okay? So you make sure they're not stretched too far. Does that make sense to everybody? Okay. How often do we do those checks?
Every time you come in.
Every time you come in the room.
The rotation.
All right. How often do we change TEDs? Take them off and do that for
24,
us. Every shift. So when I have TEDs ordered for a patient, I get 2 pairs from Central Supply or whatever, so that they can be wearing a clean pair, and I have another pair that I've rinsed out and I'm hanging up in the bathroom to change them into the next day. Or if they happen to be incontinent and they get soiled or whatever, okay? And that's something that goes home with the patient when they leave because they've paid for it. All right. Now, I'm going to change my water,
Nothing to do.
put some more soap in it,
Your arm's really tired.
put my gloves on, and I'm going to do pericare.